Dr. Kajal Ganguly, ex-professor and HOD, Department of Cardiology, Nilratan Sarkar Medical College, Kolkata. Now I am working as consultant interventional cardiologist in Amri Hospital, Apollo Hospital and BM Birla Hospital, Kolkata. Today is World PH Day. PH means pulmonary arterial hypertension. Pulmonary arterial hypertension means, in simple words, it is the rise of pressure in the arteries of the lung and the right side of the heart. It is different from that of systemic hypertension, which we measure in our day-to-day practice by measuring the blood pressure in the upper limbs. So here the mechanism and the treatment of pulmonary arterial hypertension is different from that of systemic hypertension. So pulmonary arterial hypertension basically has got 5 types, and these 5 types are of different etiologies. Some are curable, most of them are not non-curable. One variety is the idiopathic pulmonary arterial hypertension. We call it IPAH, where the arteries in the lung rise up and some small arteries are blocked, and thereby the heart has to, right side of the heart has to pump vigorously to make the blood reach the lung, and thereby it enlarges and ultimately it fails, and whereby it produces subsequently pulmonary hypertension and all these comorbidities and others. Now, the signs and symptoms of this pulmonary arterial hypertension, to start with, is usually very minimal. Patients will complain of lightheadedness, sometimes fatigability, shortness of breath, and these may be confused with any other diseases. These symptoms usually goes for these months and years, in almost 2 to 3 years time, so full-fledged pulmonary arterial hypertension is established. And from this, the mortality or the severity occurs within 3 to 5 years. So it is a grave disease. So it is to be diagnosed early and treated early to get the maximum benefit and to prolong the morbidity and mortality. When the full-fledged established pulmonary hypertension occurs, patients come with chest pain or this throbbing sensation, which is a palpitation in the chest. Chest pain is vague, different parts of the chest being at rest or on exercise. Sometimes the patient complains of dizziness, that is the spinning of the head, and sometimes the patient comes with fainting sensation, that is the syncope we call it. This is due to high pressure in the pulmonary artery. And in the extreme cases, the patient may come with this blueness of the limbs and lips, that is, we call it cyanosis. And sometimes in the late stage, they come with swelling of the legs, face, abdomen. So these are the common symptoms of pulmonary arterial hypertension. Now, those patients who have inborn heart disease, that is the congenital heart disease, those patients who have got liver disease, those patients who take weight-reducing drugs like methylamphetamine and these anorexian drugs, they are likely to suffer from this type of illness, that is pulmonary arterial illness. Also, cocaine is a notorious drug for it. Also, it runs in family. So, familial hypertension, pulmonary hypertension is also a grave disease. So, usually incidence is almost 7 to 10 patients per million population in Europe and USA. This is almost the same thing, is the occurrence in India. Now, regarding the diagnosis, in the early stage, it is to be meticulously searched for the other findings of pulmonary hypertension. We have got several methods, and the patients who give healthcare providers, they have to search the family history, take total history of the patient, examine the patient thoroughly to come to a diagnosis of pulmonary arterial hypertension. As early as the patient is diagnosed, the better is the treatment facility and the life is prolonged. So after this different modalities of diagnosis, we come to a diagnosis of pulmonary arterial hypertension and subdivided into 5 categories according to its age, according to its causative factors. those patients who have got pulmonary disease, that is the chronic emphysema or asthma, they ultimately go to pulmonary hypertension. Some patients with these heart problems, that is the congenital heart disease, or we say heart disease from the birth, and there is a hole in the heart, patients with, we call it atrial septal defect or ventricular septal defect, they ultimately develop pulmonary hypertension. This is early diagnosis is required for better management. So these patients, if we can pick up early and treat with surgery or other intervention, we can reduce the incidence of pulmonary hypertension and prolong the life of the patient. So drugs which we commonly use do not really cure the patient. It only delays the progression of the disease, relieves the symptoms, and thereby reduces the morbidity. One point is to be taken care of, that is the patients with established pulmonary hypertension should take the drugs indefinitely. They should not stop it abruptly. And the females, young females, it usually occurs in the idiopathic pulmonary hypertension in young females. They should not go for pregnancy. So when you have got these symptoms, you must go to the doctor and to your healthcare provider or your, and they will carefully evaluate you and give you the drug that will prolong the disease course, and you can have the symptom-free life for a long period of time. If necessary, you can go for the surgeries as I have mentioned. Thank you.